everyone! Today our group is going to present a case study. The title of the case study is A Patient with Right Basal Ganglia Bleeding. And then this is the name of our group members. And then this is the outline of our case study presentations. Okay, for the patient's biodata, he is 72 years old, he is married, and then the date of his admission was on 30 December 2020. The reason for his admission is because of syncope attack at 7 a.m., which was on 29 December 2020 for 5 minutes. After that, he got left-sided body weakness and headache. And his current diagnosis is right-sided basal ganglia bleeding. Okay, next is social history. He is an Iban and he is married with 3 daughters and 2 sons. He lives at Longhouse at Lubuk Hantu and he is non-drinker and non-smoker, and he is work as a farmer, and he stated that his monthly income is 700 per month. And this is his family genograms. As you all can see, he has 3 daughters and 2 sons. And then for the family history, Mr. A stated that both of his late parents were having diabetes and hypertension. And then his wife also stated that she is having hypertension and hyperlipidemia. And currently, he is on amlodipine 5 mg and simvastatin 40 mg. Other than that, so far, all of his children are not having any diseases. Next is medical history. In 2004, the patient was having pulmonary tuberculosis (PTB), and he had undergone a complete treatment and he was recovered. After that, in 2007, the pulmonary tuberculosis (PTB) was recalled, and then the patient also had done a complete treatment and he was also recovered from it. After that, the patients also diagnosed with diabetes and hypertension until now since 2008, and then he also diagnosed with right lacunar cerebral infarct (LACI) with left hemiparesis after he fell in the toilet in 2018. For the surgical history, the patient only had done 2 surgical, and one of them is in 2012, which is an appendectomy. Currently, the surgical site is clean and unite well. And then the other one is in 2018, which was hernioplasty premorbid.
Next, I will explain about the pathophysiology. This patient is diagnosed with right-sided basal ganglia bleeding. How it happened? Basically, this patient is having inadequate rest and sleep due to grieving process. This condition worsened his underlying hypertension and causing spike of blood pressure due to swings in hormone level. Swings in hormone level result in persistent uncontrolled hypertension, which ruptured the thin wall arteries in the brain. Then the blood is released into the surrounding brain tissue, result in deprive of oxygen-rich blood in the area that the artery supply. Body react and release toxin, causing further damage to the brain cells. Blood clot and fluid build-up occurs within the rigid skull, increases the pressure, which shifts the brain. In this case, this patient is having right-sided basal ganglia bleeding with third ventricle extension.
Most theory of aging falls into 2 categories, which are program and damage theory. The program theory explains that aging is already genetically programmed to occur with time and slowly deteriorate until death. Meanwhile, damage theory is explained by the external or environmental factors that cause gradual damage in cells and organs, leading to aging and death. Examples of damage theory are free radical theory and wear and tear theory. The free radical theory of aging by Halfling applies to this case, where it states that aging occurs due to accumulations of damaged cells caused by free radicals chain reaction. Free radicals are byproduct of the metabolism process, byproduct of chemical process during consumption of food and medicines, breathing process, and water intake result in productions of free radicals in the body. According to Baradaran 2014, hypertension is often associated with underlying metabolic abnormalities. Excessive formation of free radicals overwhelm the body's ability to regulate the normal level, resulting in a condition known as oxidative stress. Free radicals are formed from the normal essential metabolic processes in the human body or from the external sources such as exposure to air pollutants. Oxidative stress has been hypothesized as an aggravating factor in the pathogenesis of hypertension. Thus, due to the implications of hypertension, right basal ganglia bleed occurs. It is linked with the damage theory of aging, where the free radical contribute to hypertension and is worsened by environmental factors such as the graving process that cause the patients to have poor sleeping pattern. Meanwhile, wear and tear theory by Dr. August Weismann 1882 also applied to this case, wear and tear theory stated that human bodies will wear out over time, which suggests that the effect of aging is caused by progressive damage to the cells and body system. It explained that older people are more susceptible to any injuries or health complications due to cells wear out. In this case, the patient is having uncontrolled blood pressure due to poor sleep pattern. It causes a spike in blood pressure that leads to ruptured brain arteries. Patient age may become defective that cause the brain arteries weakening and easily ruptured, as illustrated by the wear and tear theory.
Next, diagnostic test. On 30th December 2020, computerized tomography brain had been done. The finding is right basal ganglia hemorrhage, which is the size is 2.2 times 3.2 times 2 cm. It has intraventricular extension into the third ventricle with mild dilation of bilateral lateral ventricle temporal horns. Next, on 31st January 2021, second computerized tomography brain had been done. And the finding is acute right thalamic bleeding with intraventricular extension with no significant changes compared previously. On 2nd January 2021, lumbar sacral X-ray has been done, and the finding is degenerative changes of lumbar spine and L5S1 enterolisthesis with L5 pars fracture. And lastly is on 4th January 2021, transthoracic echocardiogram had been done, and the finding is left ventricle, right ventricle, mitral valve, tricuspid valve, aortic valve, pulmonic valve, and pericardium are normal. Laboratory data. Here are some blood test results that are significant, where we have been highlighted on, which are first hemoglobin, and the result is 13.1, which is normal. White blood cell 9.4, normal. Sodium 133, which is low, and also cholesterol 3.19, normal.
For health assessment, Golden Functional Health Pattern is used to assess the patient's functional health pattern. Health perception. Patients claim that they felt better after getting treatment in the hospital, especially after physiotherapy and occupational therapy session. Nutritional or metabolic pattern. The patient was on a diabetic diet. Before this, he claimed he used to take his meal as usual with a moderate amount. But his son claimed that his father started losing appetite for the last 2 weeks. Elimination pattern. The patient claimed to have an abnormal bowels and bladder pattern. He had difficulty in passing motions where he needed to take lactulose to assist his bowel movement. He was assisted by his son to ambulate to the toilet or use a commode chair for elimination. Activity or exercise pattern. The activity and exercise pattern was disturbed due to weaknesses of his left-sided. He needed assistance with his LDL during physiotherapy and occupational session. He will use his right hand to help his weak left hand. Cognitive or perceptual pattern. The patient felt anxious due to his weaknesses. Sleep or rest pattern. The patient has had sleeping problems for the last 2 weeks after the death of his father-in-law. He takes 2 to 3 hours of a nap in the afternoon but will wake up in between the period. He goes to bed at 8 p.m. at night and wake up around 6 to 7 a.m. but will wake up in between 2 to 3 hours of sleep. Self-perceptions. The patient perceives himself as a weak man that cannot do anything. but he believed he can recover. Role and relationship pattern. The patient claimed to be unable to fulfill his role responsibility as a breadwinner of the family and as a father due to his weaknesses. He has good relationship with his children and wife. Sexual and reproductive pattern. The patient is currently sexually inactive. Coping or stress tolerance pattern. Patients claim to be a bit stressed and frustrated due to his current illness. Value and belief pattern. The patient has no problem with his religious practice. He still can perform his religious practice. So here is the geriatric assessment done on the 7th January 2021 during the interview. Findings are physical conditions fair, nursing care, need assisted care, cognitive and mental functions. His GCS is full, which is 15/15. For feeding, he needs help from the others. Bowels and bladder controls, he needs help from the others to go to the toilet. Skin integrity is intact. Personal hygiene, he needs moderate help. For ambulations, he has good head balance but poor sitting balance. He needs help during sit-up. He sits up by pulling the side rail. Patients need help from at least one person to transfer. He needs minimal to moderate help during walking. His carer is his children. For the functional assessment, we use the Kurtz Index of Independence in Activity of Daily Living (IADL) and also Instrumental Activity of Daily Living Skills to assess the functional ability of the patient. From the test, it shows a score of 2 for each test, which indicate patient is having severe functional impairment. So here is the result for the patient's fall assessment. We are using the most fall scales to assess his fall risk. So from the above most fall scale, the score is 50, which indicates low risk of fall. So yellow triangle sign have to display at the patient's bedside to alert the medical staff. Here is the psychological assessment. We use clock drawing and mini mental state examinations. So for the clock drawing test, patients only able to get 1 out of 4 score. Meanwhile, for mini mental state test examinations, patient's score is 19 out of 30, which this test indicate that patients have mild cognitive impairment. During the interview done on the 7th January 2021, the patients look well, alert and conscious. The patient's conjunctival looping, no discharge from ears, nose and eyes noted. The lips were moist and no ulcer noted. No enlargement of thyroid gland noted at the neck area. For the upper and lower extremities, capillary is less than 2 seconds, but weakness of the left side of the body is noted, which involve both the upper and lower extremities. So here is the objective data obtained during the interview. Patient's temperature is 36.7 degrees Celsius. Pulse rate is 90 beats per minute. Blood pressure when sitting is 157 per 88 mm mercury. While lying, 147 per 77 mm mercury. Respiratory rate 22 breaths per minute. SpO2 99% under room air. Pain score 2 out of 10, which patients complain of back pain when sitting. Hypercount is 8 mmol per liter, 30 minutes prior to meal.
Next is current medical management. First, the doctor ordered to continue the paracetamol 1 gram twice a day, and then the doctor also ordered to continue the physiotherapy and the occupational therapy. After that, the doctor also ordered to take the posterior blood pressure, which is in sitting and lying positions. He is also ordered to repeat the mini mental state examinations to the patient daily. And then The doctor also ordered to test for the HbA1c, and he is also referred the patients to the dietitians for the formula.
Pharmacological management. Patient has been prescribed with 8 types of medication, which is first, tablet perindopril 2 mg OD to treat high blood pressure by widening the blood vessels, and tablet terazosin 1 mg ON also to treat hypertension by relaxing the vessels. Both of these medication nursing responsibilities are ensure patient has no allergic to ACE inhibitors like benazepril and alpha blockers such as prazosin. Also check blood pressure for hourly as needed. Third, tablet pantoprazole 40 mg OD. It is to reduce the amount of acid produced in the stomach. As the patient is an elderly, it will increase risk of bone fracture. So, the nursing responsibility is the patient has to take calcium and vitamin D to prevent bone loss. Fourth, tablet metformin 500 mg BD. It is anti-diabetic to treat type 2 diabetes by reducing the amount of glucose produced in the liver. So the nursing responsibilities are check blood sugar level as prescribed by the doctor for monitoring, and also ask patient to eat medication with meals to prevent stomach discomfort. Fifth, tablet paracetamol 1 gram BD. It is to relieve mild to moderate pain. And 6, tablet calcium carbonate 500 mg BD to prevent and treat low blood calcium levels. This medication has to take with food and also record intake and output chart to monitor the bowel movement. 7, syrup lactulose 15 ml ON to treat constipation, and also the side effect is severe diarrhea, dehydration, flatulence. So the nursing responsibilities are advise patient to drink plenty of water, record the amount, color and consistency of stool. Last is syrup multivitamin 5 ml OD. It is to treat and prevent vitamin deficiency in the body. And also the side effect is constipation, upset stomach and diarrhea.
For the nursing care plan, the first nursing diagnosis is activity impairment related to the left hemiparesis secondary to right lacunar cerebral infarct as evident by severe functional impairment with score of 2 in CATS index. So the goal is the patient will join and perform activities of daily living with assistive from others or assistive devices. Our nursing intervention is first offering ambulation aid devices. Assistive devices improve the mobility of the patient by helping him to overcome his limitations. Second, allow the patient to perform activities more slowly and taking time. This will help the patient to improve his tolerance towards activities of daily living. The third is encourage the active range of motion exercise in bed. Gradual progression of this exercise prevents overexertion and fatigue of the patient. Next, assist the patient in performing activities of daily living such as bathing, toileting and feeding. As the patient have left-sided body weakness, this can prevent the patient from fall. Communicate with the patient to plan activities for times when they have the most energy. The rationale is activities should be planned ahead to coincide with the patient's energy. Plus, encourage the patient to participate in planned activities such as occupational therapy and physiological therapy. Physiological therapy held by a physiotherapist will help the patient to maintain muscle strength, range of motion and activity tolerance. The evaluation is the patient successfully performed activities of daily living with assistance from others and devices. Next nursing diagnosis is disturbed thought process related to the disease process secondary to brain injury as evidenced by mild cognitive impairment with score of 19/30 in mini mental status examination. So our goal is the patient will appropriately interact with the staff and prevent from fall during hospitalization. Our nursing interventions, first, cooperate with the physician with treatment for the underlying problem of stroke. This will prevent the relapse and recurrence of stroke that may worsen the patient condition. Reorient the patient daily, such as time, person and place. This is to inability to maintain orientation is a sign of deterioration and prior measures can be taken earlier. Third, engage the patient with social activities. This can enhance the level of psychosocial of the patient. Fourth, provide a pleasant and comfortable approach when communicating with the patient. Patient may respond with anxious if he is being startled or being approached in discomfort manner. Provide safety measures such as side rails and close supervision. As the patient have problem with the cognitive function, he may tend to be forgetful and disoriented that can lead to risk for fall. Last, put the red sign of high risk for fall near to the patient's bed. This will act as alarm to the staff to closely supervise the patient activity during hospitalization. So our evaluation is the patient appropriately interacted with the staff and avoided from the fall during hospitalization.
Lastly, I will explain about the health education that we need to deliver to the patient. Firstly, we advise the patient to compliance with the medication by ensuring consume the medication on the same time for each day to avoid complication and maintain the normal blood pressure, sugar level and cholesterol level. Second, we advise the patient to reduce the amount of fat, cholesterol and salt intake as diet can worsen his condition. The third one is we encourage the patient to perform an appropriate exercise regularly to prevent contractures, pain, swelling, and stiffness of the muscle. It also helps in strengthening the muscle at the affected extremities. Next, we educate the patient on how to manage his stress, such as doing deep breathing exercise, hearing to his favorite music, and practice religious activity. We not only educate the patient, but we also involve his family members by encourage the family members to assist the patient in performing activity daily living, because support from family members helps in motivating the patient. Lastly, we educate the family members to provide safe environment for the patient, such as maintain adequate lighting and ensure the assistive devices is working properly to avoid fall incident.
For the summary, Mr. A is still having weakness of left sided of body that involve both upper and lower extremities, but he shows some improvement in mobilizations after the occupational therapy and the physiotherapy. Therefore, it is important for him to participate in those therapy as well as compliance to the medications in order to maintain his normal blood pressure. And as for nurses, it is important to apply appropriate theory like functional consequence theory in order to enhance holistic care is delivered to the patients and to maintain his maximum self-care as well as restore his role. And this is our references. That's all from us. Thank you.